Nous avons un patient qui est ici.
We have a patient here today. We're going to meet him later. I'm going to explain what happened. He came to my clinic and he said to us, I have been to see all of the surgeons, all of your colleagues who do hair grafts, and they all refuse to treat me. They say that hair graft is impossible for me. And they were right. He has a huge bald patch. When I say huge, not one hair left on all of this area. And then, behind, there was no donor area, or nearly none. In this donor area, the hair was very thin and sparse. And he said to me, I really want my hair back. It looked impossible. So Dr. Dumas and I looked at each other and we said to him, it really is impossible. Mr. Benaissa seemed very disappointed. So Dr. Dumas and I went into a separate room and we tried to think, what could we do? What to do when there is no hair to graft into another area? And if we were to succeed, then we must have a film to witness it. So we filmed all of the procedures. And this is the film that we are going to share with you now. It was a real challenge, and as Dr. Bassani said, you have to treat each patient individually. So we decided to use the FUE technique because all of the temporal area above the ears was more than dense enough to carry out FUE. So we carried out regular FUE, and this is when you reharmonize capillary density by thinning the donor area and thickening the graft area. By thinning the donor area on the side, that is very important and it's new as a philosophy. So we carried out 3 sessions. Here you can see him under local anesthetic. It's very comfortable for the patient. And here we use micropunches of 0.7 to 0.8 millimeters. So what do we see here? Here we decided to take from all donor areas, so we took from the beard, also under local anesthetic, so that we could lean on the bone to have good contact and easy removal. We carried out 3 sessions on this patient 6 months apart. So in the first 2 sessions, we took 2,400 grafts, and in this last session we took 600 grafts. The last session was in October. FUE is quite a long procedure, as Dr. Vashnik said. We even took from the sideburn area without any scarring, and we even dared. It's quite delicate. Yes, it's really a case of looking everywhere. Exactly, we looked everywhere. So here we're in the second session, and we decided to do this with 4 hands. This allowed us to remove the hair much more quickly. Yes, because one of the problems of FUE is time. It's a very, very long technique, and here we gain 50% of the time. We're using 2 practitioners on the same patient. It's true that the aim was to thin the temporal areas, so we took a lot of hair from each session in order to reduce the density and reharmonize capillary density all over the skull, but the donor area is still very richly dense. So the last session was carried out only a few months ago. It still hasn't grown back entirely, but you will see it's a pretty good result. What size were the punches? The punches were 0.7 millimeters. 0.7 millimeters, that's the smallest punch I've heard of. We talk about 0.8, 0.9. There's even a surgeon in France who uses 2 millimeter punches. I can't even imagine the holes it does in the back of the head. It's not great. But here we see nothing. And look at the result. He has got his hair back, even though he had no donor area. He is a very happy patient. And we still haven't finished. There is 1 session left to go, and he will have practically normal hair. Is Mr. Benaissa here? For you, Your body is very important. You like to have a good image, and you were desperate. You were in despair because all of the surgeons refused to treat you. I went to all the specialists and nobody wanted to treat me. My donor area was too small. It was impossible to take grafts and put them over a very large area from a very small donor area. So we took a real risk. We say the impossible is impossible, but I'm the proof that we can always find an answer. So we started in April 2010, one session in April 2010, one session in August 2010, and another in October. And yes, we're going to do another one very soon, I hope. So, as you can see, we can still take from the donor area. Dr. Dumas was clever enough to thin this donor area so that there is less of a difference with the grafted area. So this is regular. This is why it is called regular FUE. We thin this area and we thicken the top. I would like to thank you very, very much because it was a very difficult time for me. I'm very happy now.